Health. Not all beagles will get any or all of these diseases, but it's important to be aware of them if you're considering this breed. Intervertebral disc disease. The spinal cord is surrounded by the vertebral column, and between the bones of the vertebral column are intervertebral discs that work as shock absorbers and allow normal movement of the vertebrae. The discs are made of two layers, an outer fibrous layer and an inner jelly-like layer. Intervertebral disc disease occurs when the jelly-like inner layer protrudes into the spinal canal and pushes against the spinal cord. Compression of the spinal cord may be minimal, causing neck or back pain, or it can be severe, causing loss of sensation, paralysis, and lack of bowel or bladder control. The damage done by the spinal compression may be irreversible. Treatment is based on several factors, including location, severity, and length of time between injury and treatment. Confining the dog may be of some use, but surgery is often needed to relieve pressure on the spinal cord. Surgery is not always successful. Hip dysplasia. This is an inherited condition in which the thigh bone doesn't fit snugly into the hip joint. Some dogs show pain and lameness on one or both rear legs, but others don't display outward signs of discomfort. X-ray screening is the most certain way to diagnose the problem. Either way, arthritis can develop as the dog ages. Dogs with hip dysplasia should not be bred, so if you're buying a puppy, ask the breeder for proof that the parents have been tested for hip dysplasia and are free of problems. Cherry eye. This is a condition in which the gland under the third eyelid protrudes and looks rather like a cherry in the corner of the eye. Your vet may need to remove the gland. Glaucoma. This is a painful disease in which pressure in the eye becomes abnormally high. Eyes are constantly producing and draining a fluid called aqueous humor. If the fluid doesn't drain correctly, the pressure inside the eye increases, causing damage to the optic nerve and resulting in vision loss and blindness. There are two types: primary glaucoma, which is hereditary, and secondary glaucoma, which is a result of inflammation, a tumor, or injury. Glaucoma generally affects one eye first, which will be red, teary, squinty, and appear painful. A dilated pupil won't react to light, and the front of the eye will have a whitish, almost blue cloudiness. Vision loss and eventually blindness will result, sometimes even with treatment, surgery, or medication, depending on the case. Progressive retinal atrophy, PRA. This is a degenerative eye disorder that eventually causes blindness from the loss of photoreceptors at the back of the eye. PRA is detectable years before the dog shows any signs of blindness. Fortunately, dogs can use their other senses to compensate for blindness, and a blind dog can live a full and happy life. Just don't make it a habit to move the furniture around. Reputable breeders have their dogs' eyes certified annually by a veterinary ophthalmologist and do not breed dogs with this disease. Distichiasis. This condition occurs when an additional row of eyelashes, known as distichia, grow on the oil gland in the dog's eye and protrude along the edge of the eyelid. This irritates the eye, and you may notice your Aussie squinting or rubbing his eyes. Distichiasis is treated surgically by freezing the excess eyelashes with liquid nitrogen and then remove them. This type of surgery is called cryoepilation and is done under general anesthesia. Epilepsy. This is a neurological condition that's often, but not always, inherited. Epilepsy can cause mild or severe seizures that may show themselves as unusual behavior, such as running frantically as if being chased, staggering, or hiding, or even by falling down, limbs rigid, and losing consciousness. Seizures are frightening to watch, but the long-term prognosis for dogs with idiopathic epilepsy is generally very good. It's important to take your dog to the vet for proper diagnosis, especially since seizures can have other causes, and treatment. Hypothyroidism. Hypothyroidism is a disorder of the thyroid gland. It's thought to be responsible for conditions such as epilepsy, alopecia, hair loss, obesity, lethargy, hyperpigmentation, pyoderma, and other skin conditions. It is treated with medication and diet. Beagle dwarfism. This is a condition where the dog is smaller than normal. This condition may or may not be accompanied by other physical abnormalities, such as extremely short legs. Chinese Beagle Syndrome, CBS. This is a condition that is characterized by a wide skull and slanted eyes. The dog grows normally otherwise. Quite often, dogs with CBS have heart problems and toe abnormalities. Patellar luxation, also known as slipped stifles. This is a common problem in small dogs. It is caused when the patella, which has three parts, the femur, thigh bone, patella, kneecap, and tibia, calf, is not properly lined up. This causes lameness in the leg or an abnormal gait, sort of like a skip or a hop. It is a condition that is present at birth, although the actual misalignment or luxation does not always occur until much later. The rubbing caused by patellar luxation can lead to arthritis, a degenerative joint disease. There are 4 grades of patellar luxation, ranging from grade I, an occasional luxation causing temporary lameness in the joint, to grade 4, in which the turning of the tibia is severe and the patella cannot be realigned manually. This gives the dog a bow-legged appearance. Severe grades of patellar luxation may require surgical repair. If you're buying a puppy, find a good breeder who will show you health clearances for both your puppy's parents. Health clearances prove that a dog has been tested for and cleared of a particular condition. In Beagles, you should expect to see health clearances from the Orthopedic Foundation for Animals, OFA, for hip dysplasia, with a score of fair or better, elbow dysplasia, hypothyroidism, and von Willebrand's disease, from Auburn University for thrombopathia, and from the Canine Eye Registry Foundation, CERF, certifying that eyes are normal. You can confirm health clearances by checking the OFA website, ofa.org. Regardless of how healthy your dog is when you first bring them home, you should prepare for any issues that may come up throughout their life. A pet insurance plan can help you stay ready for any of your dog's veterinary needs. Care. A fenced backyard is a necessity with a scent hound such as a beagle. When outside, your beagle should be on lead in unconfined areas, or securely confined and supervised. He's a wanderer by nature, so in case he escapes, a common occurrence with beagles, be sure he's microchipped and wearing identification tags on his collar so he can be returned to you. Some people prefer to use an underground electronic fence, but this type of enclosure doesn't prevent other animals from coming into your yard. Besides, if a scent is enticing enough, your beagle will be more than willing to risk a momentary shock to follow it. Like all dogs, beagles benefit from obedience training. Positive reinforcement techniques work best because beagles will simply switch off when treated harshly. Most beagles are more than happy to do anything for a tasty treat. Adolescent beagles are full of energy and need a lot of opportunities to work it all off. They love to go for walks with their family, or, even better, a good run across a field to hunt down rabbits, not recommended unless you have trained your dog to come back to you. They'll enjoy jogging with you, but wait until they're 18 months or older before starting them on a repetitive exercise like this. When mature, a beagle can become fairly lazy, content to lie about the house all day, getting up for meals and perhaps an occasional scratching of the ears. Since this is a breed prone to obesity, don't let this happen. Feeding. Recommended daily amount: 3/4 to 1.5 cups of high-quality dry food a day, divided into 2 meals. Note: how much your adult dog eats depends on his size, age, build, metabolism, and activity level. Dogs are individuals, just like people, and they don't all need the same amount of food. It almost goes without saying that a highly active dog will need more than a couch potato dog. The quality of dog food you buy also makes a difference. the better the dog food, the further it will go toward nourishing your dog and the less of it you'll need to shake into your dog's bowl. Beagles are food thieves. These dogs will raid your pantry and garbage daily if given the chance, and they're willing to eat until they pop. Keep yours in good shape by measuring his food and feeding him twice a day rather than leaving food out all the time. If you're unsure whether he's overweight, give him the eye test and the hands-on test. First, look down at him. You should be able to see a waist. Then place your hands on his back, thumbs along the spine, with the fingers spread downward. You should be able to feel but not see his ribs without having to press hard. If you can't, he needs less food and more exercise. Also, dole out treats sparingly. Your Beagle will be just as happy to get a bite-sized training treat as a bigger biscuit. Are you thinking about getting a Beagle? Let us know what you decide in the comments below. And if you know someone who's thinking about getting a Beagle, please share this with them. If you liked this video, check out our website. The link is in the description of this video. Otherwise, have a great day. Don't forget to like and subscribe.